Hello and welcome to the COMLEX Instant Review. Please visit www.comlexflashcards.com for complete COMLEX prep resources as you prepare for the COMLEX board exam and the USMLE exam. Please keep in mind that we have a blog that you can subscribe to in order to get daily updated information that will help you get through medical school and to the COMLEX and USMLE board exams. Let's take a look at the approach to chest radiology in trauma. Keep in mind that it's important to develop a nice system so that you can approach chest radiographs in a systematic way. We're going to be reviewing the following factors. Also, avoid satisfaction of search where you miss the key finding by being distracted by an obvious sign or a distractor as you're reading the chest x-ray. Okay, so let's start with aortic injury. The findings on chest x-ray suggestive of aortic injury include a widened mediastinum, traditionally greater than 8 centimeters. There is increased opacity of the right paratracheal stripe, loss of distinction of the aortic arch, rightward deviation of the trachea and nasogastric tube, downward deviation of the left main stem bronchus, and a left apical clap. So what do we mean? Well, as a medical student and resident, you should be able to fix and find the following findings on the chest x-ray. You can see here that there is an opaque paratracheal stripe. There is rightward deviation of the trachea, and decreased definition of the aortic arch is clearly seen. Again, another view here is going to show you an interesting finding of pseudoaneurysm. So keep all these factors in mind as you are thinking of a case with an aortic injury. Another film here showing you some of the key characteristics that will help you clinch the diagnosis of aortic injury. You are looking at a rightward deviation of the trachea. The normal paratracheal stripe is seen. You can also see a rightward deviation of the NG tube and quadad displacement of the left main stem bronchus, along with loss of distinction of the aortic arch. Keep in mind that here is another image showing you some of the key characteristics, such as a hematoma that has developed, as well as an intimal tear, which you can see, and again a sternal fracture. So those are all causes of aortic injury that you want to make sure you look at as you are reading the case on the COMLEX board exam, or as you're on your wards and examining cases. Now let's review bronchial injury. Well, B is for bronchial injury, and this deals with lacerations of the trachea and bronchi. These are rare injuries in blunt trauma and often are missed. Most injuries occur within 2.5 centimeters of the carina and involve the bronchi more frequently than the trachea. Also, there's a tracheal bronchial tear, and radiologic findings that point towards tracheobronchial injury include a pneumothorax, pneumomediastinum, subcutaneous emphysema, persistence of pneumothorax after placement of a chest tube, and a characteristic fallen lung sign, which is collapse of the airway from the hilum. As you can see in this image here clearly, we have several things going on. A pneumothorax can be seen, and you see an atelectic lung fallen away from the hilum. Both of these are key characteristics of tracheobronchial tear. Again, keep in mind another image here showing you the characteristic fallen lung sign. Let's take a look at another chest x-ray and review some of the key characteristics that you do not want to miss as you're examining cases. Here you see a pneumomediastinum. You can see the chest tube placed. You can see a persistent pneumothorax. And again, all these lead you to a bronchus intermedius tear. Now let's review additional cases here that you do not want to miss while you are on the wards or preparing for the board exam. You can see that, again, a characteristic of lung falling away from the hilum. This is a characteristic sign. You see the chest tube placement, and all these are signs of a persistent pneumothorax. Again, now we're going to move on and be reviewing C, which is for cord. 62% of patients with thoracic spinal injuries have neurological symptoms. 70% of thoracic spinal fractures will result in signs of mediastinal hematoma on the chest radiograph. And if there's a concern about spinal injury, dedicated plane radiographs of the spine, or CT, must be looked at. The most common types of fractures are anterior wedge fractures and burst fractures near the thoracolumbar junction. So let's take a look at some of these cases here. You have an anterior wedge fracture, and this is a wedge compression fracture. Clearly you can see this, and you don't want to miss this as you are on the wards and preparing for the board exam. Another sign here, clearly easy to see, and this is a characteristic burst fracture. Again, some key findings. Again, a burst fracture, a hematoma, and here you have a rib fracture with subcutaneous air and underlying pulmonary contusion. And so this is an excellent view showing you a thoracic spine fracture. C is for contusion. Pulmonary contusion is best characterized on a CT scan, and you have to differentiate this from aspiration, atelectasis, and pulmonary edema. There will be focal areas of consolidations representing areas of edema and parenchymal hemorrhage. Also, non-segmental consolidation, usually in the periphery and adjacent to the chest wall trauma, can be seen. This usually resolves in 2 to 3 days. Okay, so the focal areas of consolidation representing edema and parenchymal hemorrhages are key, and then the non-segmental consolidation in the periphery. So what do we mean? Well, let's take a look at another image, and here clearly you can see signs of the contusion. Now let's review the diaphragm. And the diaphragm injuries are rare in blunt chest trauma patients, usually left-sided and posterior lateral. More easily, they're diagnosed in the absence of positive pressure ventilation. The radiological signs include a collar sign, which has pinched stomach or loop of bowel in the chest, and dependent viscera sign, which is any segment of the GI tract in contact with the thoracic wall without intervening diaphragm. Again, we have an image here clearly showing you that the collar sign, the diaphragm injury, characteristic signs that you do not want to miss. Again, another collar sign for diaphragm herniation. And let's take a look at another image for board review. You see a dependent viscera sign here. So that was an overview of some of the most common radiological findings you're going to see in trauma cases in terms of the chest x-ray and the CT. Please visit www.comlexflashcards.com for complete COMLEX prep resources, and good luck in your preparation for the board exam.